Good day. So today I will be presenting about a case with regards of opioid dependency. So the case is, you are asked by the supervisor to present the information at a staff meeting on how to promote optimal response in a patient being treated for opioid dependency. Discuss the anxiety issues that may be involved, the nursing responsibilities, and the problems that must be addressed to assist the patient to adhere to his treatment regimen. The case facts are: first, we need to remember that we are in a staff meeting, and then the topics about opioid dependency with the patient having anxiety issues. We need to also discuss the nursing responsibilities and the problems that may arise with regards of the treatment. But first, what is an opioid? So opioid came from an opium plant that is being used to relieve pain. Here's how opioid and pain works. Opioids take effects on neurons through the receptors mu, delta, or kappa that can be found on neuronal cell membranes. Opioid receptors and many other membrane receptors are coupled to G proteins, which consists of three subunits alpha, beta, and gamma. When receptors are occupied, the subunit is uncoupled and forms a complex which interacts with cellular systems to produce an effect. In postsynaptic neuron, opioids are usually inhibitory, which is the major mechanism of opioid action, while in presynaptic nerve terminals, the effect is excitatory. So let's say the patient has been diagnosed with anxiety due to her environment. Here rises several stresses that could worsen or trigger her condition, such as family, school, relationship with other people. The doctor ordered lorazepam Ativan 1 mg per oral twice a day. However, due to the triggering factors from the environment, the patient takes his medications every time he experiences attacks, leading to opioid dependency. Upon admission having lorazepam overdosage, we must first approach the patient in a non-judgmental way since there is an addiction. Thus, there must be a cause or an origin of the situation, such as in the case, the patient lives in an environment that triggers his anxiety. Next is to give interventions based on the withdrawal symptoms that may be assessed to the patient, which can be appear from 8 to 12 hours of withdrawal. So the symptoms are extremely anxious, irritable, insomnia, bad headaches, hand tremors, muscle aches, hard to focus, restlessness, sweating, racing pulse, hyperventilation, nausea and vomiting, hypersensitivity to stimuli like light and touch, visual disturbances, feeling of unreality, and also for the severe cases of high doses withdrawal, hallucinations, delirium, and grand mal seizures. So based on the withdrawal symptoms present in the patient, according to your assessment, here are the nursing interventions that could be given to the patient. Place the patient on a safe and well-ventilated environment. Reposition the patient according to the area of pain. Talk for encouragement. Check the vital signs. Adjust the light in the room. Remove any triggering objects that could cause self-harm. There should be no sharps or utensils, no ropes, any belts, or any shoelaces. Music therapy could also help to the patient. And lastly, relaxation techniques. So another intervention that could be helpful to the patient is to help him avoid any attempt to quit all at once. Decreasing progressively the dosages over a period of several weeks and months could lessen the dependency of the patient to the opioid until there comes a time that he won't look for the opioid or the medications anymore. So the interventions mentioned were all non-pharmacological measures. If ever that those interventions were not effective to treat opioid dependency, the last resort to be given should be giving a medication such as Narcan, which is also based on the dosages needed of the patient given by the doctors. To end this video, anxiety is a mental illness that could lead to opioid dependency due to the pleasure it gives during the attacks. As a nurse, we must remember to use non-pharmacological measures first since we are dealing with addictions already. So that's all. Thank you for listening.